Thank you all for joining us today. Before we begin, please remember to keep your microphones and videos off to avoid distractions. You can submit up to 2 questions to the moderator by chat, and please submit your questions as clearly as possible with your name and outlet information. Welcome, Dr. Colfax.
Thank you, and good afternoon, everybody. Thank you for joining for this update on COVID-19 in our community. I think it's very important that we step back for a moment and realize how dire our situation is. At this point, many of us know or possibly have been diagnosed with COVID-19, and hopefully people have done okay. But despite that hope, unfortunately, many of us know people who have become very ill and died. Simply put, this virus kills. America has lost more people due to COVID-19 than during World War II. Across the country, as many people are dying daily of COVID-19 as died in 9/11. And yet this surge continues with no signs of slowing. In fact, cases are rapidly rising and hospital bed availability is shrinking across the state, the region, and San Francisco. The Bay Area continues to struggle with patient loads in our intensive care units, and we expect demand over the next 2 weeks to increase. And while this situation is serious and we are struggling, at the same time, we are on the brink of a historic moment for our city and for our nation. The rollout of the COVID-19 vaccine is beginning. It will be a long rollout and too late for this surge, and even more difficult if we don't remain vigilant in our fight against COVID-19 while also racing to roll out the vaccine. First slide, please. Across the state, California continues to see a surge in new cases and hospitalizations. There is just 7% intensive care unit capacity across California. The Southern California and San Joaquin regions of our state have less than 5% intensive care unit capacity remaining, and hospitals and counties in these regions have run out of intensive care unit beds. In the Bay Area, our intensive care unit ICU capacity has fallen from 26% to just 17% in less than a week. And it doesn't appear that this downward trend will be changing anytime soon. Next slide, please. This slide shows our hospitalized COVID-19 patients trends in San Francisco since the beginning of the pandemic. Hospitalizations of COVID-19 patients continue to rise steeply, with 148 patients in hospitals across San Francisco and 37 patients in the intensive care unit. We have more San Franciscans suffering today from COVID-19 than we ever have before. And as I have said before, but it's worth reminding all of us, hospitalizations lag about 2 weeks behind infections. If the hospital census keeps rising at the current rate, San Francisco will run out of intensive care unit beds within the next 3 to 4 weeks, as the state and region can also no longer care for sick people due to an overall shortage of intensive care unit beds. If things worsen, we will run out of beds sooner. Remember, when we run out of ICU beds, we cannot adequately care for people. There are simply not enough beds, and we don't have the nurses and doctors to care for so many people. Now, with regard to cases, new cases in San Francisco surged by 50% after Thanksgiving. We estimate that there are currently 2,897 diagnosed active cases of COVID-19 in San Francisco, and that's just diagnosed. The total case number since the beginning of the pandemic is 18,000 645. For the last week, we have averaged over 200 new people testing positive for the virus each day. Our hope this week is that cases stabilize, but we do not know for sure that that will happen. And I hope that people do not travel this holiday season and that people do not gather with those outside of their household, their immediate household, that we beat back this virus. The future is in our hands and we have the power still to choose our destiny. A destiny where this holiday season can be the gift of crushing the curve and we can begin to roll out the vaccine to end this pandemic. That is the holiday season I am hoping for. That is the holiday gift that I am hoping for, and one that we can all participate and share in. End of slide, please. Today, the first batches of COVID-19 vaccine are arriving in cities across the country. Let's pause and reflect on this historic moment and acknowledge all that we sacrificed to get here. Let's give thanks for the life-saving vaccine that is on the way. But I cannot emphasize enough, we still must remain vigilant because the hope of this vaccine will not crush this curve. And with limited supply, the vaccine will not save us from this current increase and surge in hospitalizations. Only our immediate actions, the actions that we have been taking since the beginning of this pandemic, that we know work to slow the spread of the virus, those are more pivotal and important than ever before. Please, let's give the gift of health this holiday season. Please, don't travel for the holidays. Protect your loved ones. Do your part. Sacrifice this year so that we can all be together next year. Stay home, do not gather, wear a mask. Our actions do save lives. And with so much virus out there now, you simply are not going to be able to get away with behaviors that you may have before. Let's all make sure we get the vaccine and have a great big holiday gathering next year. Thank you. Stay safe, stay vigilant, and stay home.
Thank you, Dr. Colfax. I did not realize I was muted, but in a few short moments, we will begin with the question and answer portion of the press conference. All right. If you're ready, Dr. Colfax, we'll get started with the questions. Dr. Colfax, your first set of questions come from Kevin Stark with KQED. The question is regarding the Pfizer vaccines. When does San Francisco expect to receive its first doses of the vaccine? And as a follow-up, how many doses and who will receive the first doses?
So I appreciate the question. And again, this is really a historic moment. So our first, we received 2,000 doses of the vaccine at Zucker San Francisco General Hospital this morning. And obviously it's incredibly important that we vaccinate people as quickly as possible. And we will be keeping the public updated on progress in that regard.
Oh, sorry, once again, I was muted. That concludes today's press conference. There are no other questions for today. Thank you, Dr. Colfax.
Thank you.